Okay, so welcome back everyone. In this video we'll be discussing about the fasciculatory tremors which are seen in the patient of ALS. So this ALS is amyotrophic lateral sclerosis. So we'll be discussing in detail about fasciculation in this video and also about the ALS. So I'll be sharing some facts here. So this is Stephen Hawking, the physicist and professor. He had ALS. So we'll be discussing about the pathophysiology here. So what is actually like fasciculation? So fasciculation here, this represents an early pathophysiological hallmark of amyotrophic lateral sclerosis. So like how fasciculation occurs, like what are fasciculation, here we'll be discussing in detail. Okay, so what are actually these fasciculations? We can see in this video that there is slight twitching. So what is this fasciculation? So there is spontaneous depolarization of a lower motor neuron leading to a synchronous contraction of all the skeletal muscle fibers within a single motor unit. So within a single motor unit, we have to know that there is synchronous contraction of all the skeletal muscle fibers. So what is actually the pathophysiology in ALS? Like how this ALS occurs, So here we can see normal versus the ALS diagram. So in this ALS, we can see that there is actually breaking of the nerve cells in the brain and the spinal cord. So there is destruction of these motor neurons, the upper motor neurons as well as the lower motor neurons, and the myelin sheath ultimately becomes hard. So this ultimately leads to like deterioration of the motor neurons. Okay, so we have discussed this. Now coming to like this damaged alpha motor neurons, these can produce spontaneous action potential. So the patient is having a lower motor neuron lesion, and these damaged alpha motor neurons will produce spontaneous action potentials, and these spikes causes the muscle fibers that are the part of the neurons motor unit to fire, resulting in visible twitch. These are called as fasciculation of the affected muscle. So we can see in this video that this patient is having like these spikes are producing fasciculation, a visible twitch, because of this spontaneous discharge of alpha motor neurons. Another we can see here that fasciculation of the ALS, this is the tongue fasciculation which we can see. So this ALS also causes like upper and motor neuron lesion, and we can see in this patient that we have seen previously we have seen the hand fasciculation. Now this is the tongue fasciculation. So we have discussed about these two features which are very much important in distinguishing the other tremors. Like fasciculation can be differentiated from tremors via these features. So this was all about amyotrophic lateral sclerosis. I hope that this video was useful. So share it with your friends. Okay, thanks for watching guys.